Good evening, Dr. Guruparan. It's a pleasure to meet you in Jaffna Teaching Hospital today. Could you please tell us your role in this hospital and what are your responsibilities?
Thank you for coming. I'm Guruparan. As you said, I'm one of the consultant cardiologists attached to the Teaching Hospital Jaffna. I mainly cover patients from Jaffna, but as there are no cardiologists in other districts like Mannar, Cardioogy and Echocardiogram, patients are also referred to us to Jaffna from those places by the physicians. We basically have a 16-bed ward, a 5-bed CCU and a cath lab, and we perform regularly the echocardiogram and angiograms and some of the cardiac interventions.
Okay. What are your demands, just related to that, what are your demands on a daily basis? How many patients would you see, and of that, what's the proportion that come from outside Jaffna?
We cater to a population of about 1.5 million, that is including about 500,000 from Jaffna district. So as you can see, most of the patients are from outside Jaffna, and we perform about 70 to 80 echocardiograms a day and about 100 angiograms and about 15 to 20 angioplasties a month.
Okay. So that sounds a lot, and as a result of that high demand from outside, Assist RR, which is a charity based in UK and Sri Lanka, recently held a short clinic in Mannar District General Hospital, where they performed echocardiogram for 5 days and performed about 250 echocardiograms. What are your thoughts about that, and would you like that to happen in the future?
That's very encouraging and supportive. That means I can relax and do less echoes from Mannar. That also helps us to screen the patients who have disease, and then we can selectively spend more time on those who have been identified as having disease. So definitely it helps, and we hope that there may be more sessions like this in future.
Okay. Thank you, Dr. Guruparan. We wish to thank you for supporting us in Mannar on this project. The next question is, what is the most pressing need from a cardiology perspective in the northern province at the moment?
Yes, there are multiple needs. One is the resource, both financial and human resource limitations. As I said, there are only about 2 or 3 cardiologists in Jaffna Hospital who cater to a population of about 1.5 million, that is the whole of northern province. And for certain procedures, even patients from Batticaloa and Ampara had to come to Jaffna because the facilities are not available in East. So we are overworked, and the burden of work is too much. So anyone who comes and helps, like Dr. Mayuran did, would be of massive benefit to us. In addition, we have also financial limitations. There is a cardiac surgeon appointed to Jaffna, but due to lack of facilities, he has not started work. So any financial help to build up that unit also would be of help.
Okay. So talking about building up a cardiac surgical unit, can you explain to the viewers what is it that the diaspora or the well-wishers of the northern province could do to help you?
One of the main issues that we face daily is the patients who need surgery not being able to undergo that surgery because of the long waiting list. So we have a relatively good solution for that. We have got a surgeon here, but due to lack of surgical theatre facilities and particularly the lack of bypass machine, he is still unable to operate. The government of Sri Lanka has agreed to buy one machine for us, the bypass machine, but it is mandatory that we have a second standby machine for anyone to operate on a patient. So we are looking for funds to see whether we could buy a second machine.
Okay, that's fantastic. And if there is an organization or an individual that wish to help you, either financially or in person, can they get in touch with you?
Yes, definitely.
Okay, we'll provide the details at the end of this clip. Thank you. Thank you for your time, Dr. Guruparan.
Thank you.